Welcome to CareHero podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Hello, Care Heroes. Welcome back to Care Hero Podcast, the show that aims to educate, motivate, and inspire nurses and other healthcare professionals like you. I'm your host, Gerard Hernandez.
And I'm Martin Hoy. I was still a bit under the weather during this episode, so we have our awesome guest co-host, Paula Hildy, filling in for me once again. But don't worry, we have another amazing guest on this Care Hero podcast episode.
Yes, we do. We have Barbara Jacobs, Vice President of Nursing and Chief Nursing Officer at Anne Arundel Medical Center in Annapolis, Maryland. She's an experienced and accomplished healthcare professional with almost 40 years of nursing under her belt.
Amazing. And Barbara has a great story and fantastic tips to share, including how you should listen to your heart and find your purpose, to be brave and step outside of your comfort zone, the key importance of communication, to never stop educating yourself, and to always remember how helping one person can affect the lives of everyone around them.
Sounds good, Martin. Let's go. Barbara, welcome to the show.
Thank you.
Great. We always kick off our show with this question. All of our care heroes, including yourself, are superheroes. But if you had to choose one superpower, what would that be and why?
I kept on thinking about what this would be. And, and there is one superpower that I actually thought about afterwards, that it would be quite powerful when you're somebody who's in a leadership position in a hospital, and a cloak of invisibility would be helpful. If every now and then you could just become invisible and walk through the halls and actually be able to see what's going on without bothering people, but just being able to really be able to walk through the hallways without being recognized would be powerful to me. Sometimes it's great when you're trying to walk between meetings and you can't quite get there because you're also stopped by many people as you're walking through the halls. It's usually good to be stopped, but sometimes when you're actually trying to get someplace in a very tight time frame, it wouldn't be bad to be able to be invisible sometimes too.
Yeah, so of course there's the clinical side, but yes, so there's also the fact that in your position, you're just inundated with so much work too, right? And we're excited to be able to dive into all that you do in your career, your current facility right now too. So that's terrific. That's a great invisibility cloak. I'm a Harry Potter fan, so I love that idea.
That's every now and then. Especially if you're going in at 7 a.m. because hospitals start at 7 and you're at 6:58 and you're leading the 7 a.m. meeting and somebody just needs to stop you to tell your story right then.
Of course.
That's
when
right.
the next shift starts.
That's so true. So
Yeah.
Barbara, you have a very impressive and accomplished career, like almost 40 years, and a lot of it, in fact, almost all of it has been in management. Can you kind of tell us a little bit about your background, your life story, and how you got into healthcare?
I always knew that I wanted to be in healthcare. To me, as a young kid even, the idea of helping people was what touched my heart. My father's family was from deep Appalachia. And I read these books when I was probably a young teenager about these nurses going into Appalachia and helping the poor. That was the final motivation to me, that I could touch lives like that. And as I went through school, I had actually done very well academically and was a National Merit finalist and such. And other National Merit finalists were going to be astrophysicists and such. And I said, I think I want to be a nurse. And so for me, it was always this feeling that nursing allowed me to really get close to touching the hearts of people. And that's what meant a lot to me.
Oh, that's awesome. Like I said, you moved up in management very quickly. How did that evolve?
I was fortunate that I got my BSN straight from, I went straight through my undergraduate and got a BSN in nursing. So when I got out in the late 70s, there were not a whole lot of BSNs. There were BSNs, but there weren't a whole lot of BSNs. So that automatically gave me a little bit of a step above. But I took my first job at what is now Robert Wood Johnson. It was called Middlesex General Hospital then in New Brunswick while my husband was getting his master's. And a chief nurse there kept offering me opportunities. And when I initially went in, I was working on a surgical floor, learning all this cool surgical things. And then she came to me and said, I think I have an opportunity for you on what was then called the general medical floor, a medical teaching floor, which meant the patients were all uninsured medical patients. And they were actually in a part of the building that had no air conditioning at that time.
Oh.
Even in the
Oh.
70s, had no air conditioning. It was like, why would I ever want to do that? But I trusted her to guide me. And each of these opportunities took me another step up into little beginning levels of management. And so by the time that I left there, in 5 years, I had worked my way up to assistant director of nursing, but it was really being willing to take the gamble with what she was recommending and take the opportunity to step into very different parts of nursing to not be sure that I knew the right path initially, but that others might be able to guide me to the better path. And to find that mentor that you trust, and it might not be one, it may be many, but that somebody that you can trust to mentor you. And it's one of the things that I really enjoy now is I mentor different students, graduate students or undergraduate students in my work, because again, this is what makes me feel good about helping. I said they might enjoy being able to work with me. They say that, but I get much out of it too, that I know that I was helped early in my career. I went from Brunswick, I went into the Philadelphia hospitals mostly when my husband transferred his work, and we had small children. And I said, I'm going to be doing a whole lot of hardcore clinical work, get my clinical skills really, really sharp. So I did heavy critical care work, and then we moved again to Washington, D.C. And now I had excellent clinical skills. My children a little bit bigger. Again, people were stepping forward to say, I think I have this opportunity. I took the opportunity to become into leadership in critical care and was the director of critical care and the emergency room at different times and the cath lab and the IR suites. Again, it's always like, here's something that I have for you. And then made the moves into deciding that I was ready to be a chief nursing officer and moved to another hospital. It had to be brave. You have to be brave enough to be willing to take that step outside. But again, with a lot of people helping, a lot of people offering opportunities that you have to be willing to take.
Currently, you're the Vice President of Nursing and CNO at Anne Arundel Medical Center in Annapolis, Maryland. Could you tell us a bit about your role and what you do there?
So Anne Arundel is the third busiest hospital in the state of Maryland. So it's a busy facility. We see, for people who know hospitals, pre-COVID, we were seeing about 100,000 in our emergency room, which makes it an extremely busy, by far the busiest ER in the state, and about over 5,000 births. We have a lot of babies and a lot of emergency room and a lot of elective surgery also. So a very busy facility. So I'm responsible for every bit of nursing practice that occurs on a campus. So obviously, it's not that I can watch. There's 1,300 nurses or so, plus the people that work with them that also report up through me. I can't see each one of them every day or every week, but I'm responsible for the overarching practice of nursing at this facility. It's really a wonderful job to be able to have the feeling like you can help again guide the care for so many patients to help establish what you hope is good working environment for these nurses and the staff that work with Bellwood.
Just the idea of overseeing 100,000 ER visits, right? 5,000 births and 1,300 nurses. We're definitely going to go into how Barbara Jacobs does this. That's just phenomenal it blows my mind to think about.
I often say that when we're at meetings, nurses, I'll have a bunch of nurses in meetings, and I'll say, think right now, think right at this second, how many people are being touched by nurses, right? And at this, there's 50 or 60 in the emergency room at this moment, and there's 70 people having surgery, and there's 385 people in beds, and there's people coming in for cancer treatments. And so at any minute, there's hundreds of patients being touched by nurses. It's like daunting when you sit there and think that, but it's also this wonderful feeling that, hey, this is all working. This is right now, those hundreds and hundreds of people are getting good care. And so that's the wonderful part of it.
listen to you. Like before I joined Jerry, I was a director of HR in hospitals for over 20 years.
Oh, yeah.
And for someone who's worked for over 40 years, your heart and soul is so into healthcare. So you were definitely born to come into healthcare. What's your typical day look like? What in a day in the life of Barbara at work?
Well, I can tell you that it starts before I get to work, because soon after I get up, I am looking at the electronic information that I've gotten about what the status of the hospital is right now. I will have been called if there is an terrible emergency, but just in the normal operations of the hospital, I would early in the morning have an update of how many patients are in the emergency room, how many patients are still in need of beds, how many patients are going to have surgery, that type. So I have an idea of how the hospital is operating before I even get to the hospital. Then meetings start anywhere, like today they started at 7 a.m., but sometimes on a late day, it might be 8 a.m. We start with, so it could have some general meetings in the morning, about 8:30 at our hospital, and at many hospitals, there is we call it a bed board, where all the units report what the status of their units are, how many patients they think might be leaving today, how many surgical patients look like they're going to require inpatient beds, how many cath labs are going to be done. It's just an overall report of all the units early in the morning, so we know how to stage the day. We also know or want a report of anything that is not as it should be. We don't have equipment, we don't have staff, we don't have whatever. We want to hear what problems that the units are having, or if there's a patient or a family that's having a particular issue that might need to be dealt with. These meetings became extremely important through the time of COVID. We still have today we had 55 COVID patients still as inpatients. So we still have COVID, but we are all hoping we're over the top. I think every hospital in the country is hoping we're over the top. But these meetings became extremely important as we had issues with PPE and things you never even thought of that you would run out of just because supply issues became so challenging. Dialysate or some strange kind of tubing that you never we had a shortage of thermometer covers for a moment because everybody was running around buying thermometers. And so we had to keep making sure that we knew what we were missing, what we needed to find alternatives for, and what was making it difficult for nursing care to be able to be delivered.
Absolutely. So, I mean, you're very strong that for our readers that communication is key.
And actually, through COVID, we did a survey in spring peak. And in the middle of it, we surveyed the staff and said, what is it that they needed most? What was the most challenging piece of this? And what did they need most? And the most challenging piece with COVID was this fear of taking their disease home. Even though we all deal with infectious diseases all the time, this unknown disease, what it was going to be, the fear of staff that they would be taking it home. And then it was just information. I need information. I need more information. Tell me again. The importance of communication became so apparent through this.
Due to the nature of your role, you have your hands overseeing many things. Is there something that you love the most about your role?
I would say that one of the things that I love the most is like tomorrow morning I will be we are a magnet hospital, which is, there's only about somewhere between 7 and 8% of the hospitals in the country that are magnet. But one of the hallmarks of a magnet hospital is that there's really shared governance, that you have the frontline staff working with leadership. And so tomorrow morning, I'm with one of the council that we call the Professional Nurse Council. This is all frontline staff. And it is one of the things I look forward to the most, is being able to talk to them. They, of course, want information from me. But as I say to them, what I need from you is information from you. And it is just this enjoyable time to see a lot of them young nurses blossoming in their careers, and to see the energy that they have and the desire they have to make sure that the best care is being given also. Another thing that we have, which is really something that's developed over the last 10 years in my career, is we have patient family advisors and patient family advisory councils. That another just really unbelievably meaningful time to be once a month meetings. These are patients and families in our community that are volunteering the time to give us information and to help guide us into how do we communicate this to patients? How do we make this better? Also, very meaningful time. And one of the things that I'm working on right now that has meant a lot to me personally is we got involved with the development of how do you define what a age-friendly health system would be. And we were fortunate to be chosen to be one of the 5 systems in the whole country to be involved with work with the Hartford Foundation, which is one of the major charities that supports geriatric education for healthcare workers, and Institute of Healthcare Improvement coming together to really define for the whole country, and now actually probably a little bit in the whole world, because they're actually doing stuff overseas, of what does a age-friendly health system look like. And not even just in the hospital, but in the clinics, in the urgent care centers, in the emergency room. What are some of the basic tenets of an age-friendly health system? That's been really meaningful, again, to feel not only that you're changing the healthcare for your hospital, but actually helping shape this for the entire country.
Yeah, and that's something actually we wanted to ask you about. Yeah, it's that work with the age-friendly care and IHI, right, and the Hartford Foundation.
Yeah.
Could you just elaborate more for our listeners, this work that you're doing?
The Hartford Foundation, and if any of your listeners are part of hospitals, some of them will have had niche units. It's called niche, Nurses Improving Care for Health System Elders. That was funded and founded by the Hartford Foundation. They decided that the work that they were doing, which was supporting education around geriatrics, but they wanted to go broad. And how do they really change the perceptions of care of our oldest patients? How do we change that for this country? And so they partnered with IHI, and Don Berwick and all the great people at IHI really have helped support this work. And what they did is they said, we want 5 health systems in the country to come together. We'll bring all kinds of experts to them, and with some from our own and some brought to us, to begin to develop what are the things that every health system, no matter how small, how big, outpatient, nursing home, whatever, what are the things that they all should be looking at? And it became 4 major categories. And one is medications, that really in attention to the appropriate medications for a geriatric population, which is something that health systems, hospitals are not always good at. We give the same medicines to an 85-year-old that we give to a 25-year-old. So medications is one. Mentation is another, determining the patient, are they oriented, are they disoriented, are we making them disoriented, are we giving them medicines that are making them disoriented? And so we carefully learn ways to assess their mentation. Their mobility is another. One of the things that in a hospital, we had a niche unit. We thought we had we did have a terrific unit. Every patient got out of bed, had their breakfast in the chair. We were really proud of that. And then around lunchtime, we put them all back to bed, and they maybe got up another time, but we realized we really weren't mobilizing them. When we really started studying it, we weren't really walking these people. And we were allowing them to lose sometimes their ability to walk by the time they left the hospital. Very common in hospitals that you don't emphasize the mobility, but that same concept can go into the offices about making sure that an older patient is walking and moving and doing everything and is safely moving. And the 4th M is actually a play on words. It's what matters, so that we actually find out what matters to the patient, and that what matters to me may not be what matters to this patient.
This is terrific. No, thank you for enlightening our listeners about age-friendly health systems. We'll definitely put links on the show notes to learn more about this and what IHI is doing.
I would definitely, because there's like almost 2,000 hospitals, nursing homes that have participated in the work. You can get on and for free participate in some of the work. And it's a great way to mentor with others, to partner with others across the country, to learn what they're doing, and to learn like the ahas like we had. We weren't really mobilizing people. We were very proud of them all getting up, but we really weren't mobilizing them, and how we could make a difference. And we've, for example, been able to show that we've reduced the amount of patients that actually we've increased the numbers that can go home, because we feel like it's significantly because we're walking them.
That's awesome. We all have challenges at work, and I know your experience with the COVID that I think one of the biggest challenges right now is new grads. What advice do you have to new grads who have entered the medical field during this whole pandemic? I'm sure they're disheartened. What advice do you have for them?
Well, actually, I'm on the board of the Maryland Organization of Nurse Leaders. And one of the things that we came together with about 3 weeks ago is to say that we need to send a letter to all the new graduates in the state to tell them that we get it. You did not have a normal experience. There is no way that they can come out with the same training that other nurses have when they were not allowed access to patients. They were able to do simulations, some of them even only modified simulations because they couldn't crowd the simulation rooms that much. So we thought it was really important to allow them to know that we as the chief nurses recognize that they're going to require a different level of support than another new graduate. We've actually, as a state, come together with our new nurse residency programs. Maryland actually is a state that the entire state's come together to share our information about our training of new graduates. And so we've we've recommended to everybody a modification of the normal training of the new graduates, and that it has to be prolonged and it has to be more intense initially. And so I would say that to new nurses around the country, a recognition that we're not alone. When I talk to CNOs around the country, we recognize that there is no way that they can have come out with the same training. It does worry us also, though, that our nurses are tired. I mean, this has been a heck of a year. So we have to take care of those preceptors too. The people who will be training the new graduates as they come in need support from us too, because they're tired. This has been a tough year for healthcare workers.
It has. And thank you. I'm sure that's very uplifting to the new grads who are just kind of out there going, oh my goodness, So thank you. That's great.
But how about for yourself? How do you continue to learn to stay on top of your own role?
I'm one of these people who loves to read. So I'm a member of several professional organizations. So I get journals from those organizations, plus participate in different sessions. Now everything's Zoom, but it used to be that I could actually go to conferences. So we have some within the state, and I'd also attend national conferences. I always recommend when I'm mentoring young nurses, if you get the opportunity to go to a national conference, you make sure you go to the keynotes. Go listen to those keynotes, because they can often be the thing that just will put this seed of something in your mind that you can then use to help guide you in your care or in the care of yourself. I would recommend to anybody the energy that you can get from participating, even on the Zoom. We've learned to do it on the Zoom. The information and the energy that you can get from others who are doing the same thing as you, trying to figure it out, not perfectly smooth for anybody. Everybody has bumps as they go in, and people will willingly share, like, this worked, this didn't work, and then to be able to reach out to people around the country to say, how are you doing on this?
Kind of walk us through how you got where you are, not necessarily through the education, but how else? Like, how did you get to be such a compassionate, caring person as you are?
I guess one thing is that you always think of what is your purpose? What is the deep in your soul is what makes you satisfied. I academically had done very well in math. So people were really pushing me into computer science. It was fascinating, but it didn't talk to my soul. I love that people who can do that stuff, but it did not. What fulfilled me was being able to feel like I was able to touch the heart of a patient somehow. And so I think one of the big things for nurse leaders, or not even just nurse leaders, I often talk about this with any of the clinical lead. If you really want to get them to come on board when you're trying to make a change, you've got to speak to their hearts too, because most clinical people do what they do because of that. If you can tell the story of the patient that's affected by this, and so I'm a very big storyteller of, let me tell the story of this patient. let me tell, this happened in our place. This didn't happen somewhere else. This happened in our place. That's a lot of what we did when we were first talking about the age-friendly work, is tell the stories of older patients in our own facility that probably could have had a different outcome if we were more engaged with this work to begin with, which then got people interested. But you really, to make healthcare workers want to jump on board, you've got to be able to tie it to what motivates them, which is feeling like I'm making a difference to a patient, not that I'm fixing numbers.
We talked earlier about your work with communicating or meeting with your frontline staff. So in your experience, what's the best way to communicate with management?
There's all different ways. Again, you could tell a story with management. You have to understand that audience that you're talking to also. How I might talk to the finance people might be a little bit different, but you can still bring them back to patient stories. You do need to know the business part of your job also. So I've also said to nurses so nurses are in most hospitals, they're the biggest part of the workforce, and we're an expensive part of the workforce. So we can't pretend that there isn't a business part of nursing. So it's very important for nurses to understand the business part of nursing, what we can do to make sure that we're managing the business side, the staffing, the overtime, that we're managing that effectively so that when we need to talk to others, it's obvious that we understand the business side as well as the clinical side. I think it's very important to take a minute to think of, what do I think the purpose of the person is that I'm talking to? And so let me make sure I'm speaking a little bit to their purpose, because that's going to make them more receptive to listening to me.
I'm sure you've had many, many moments in your career that have been both rewarding and inspiring. If you were to think of one that was the most inspiring or rewarding, what would that be?
There's nothing like being with a team that saves the life of a patient. You know that this person would not be alive if your team did not function perfectly. And to be able to even stand back, either be a part of that team or to stand back and recognize that's your team that's doing this, is enormously satisfying. But I have to say, personally, I have also felt extremely satisfied in know that when death is a reality in a hospital, it is certainly a reality in critical care unit. And I'd say when I interviewed people, for you to be a truly successful critical care nurse, you have to feel equally good about saving the life of a patient or helping them have the best death possible. I could go home feeling very satisfied that I knew that I had done that or been a part of that, or the teams had done that.
And it sounds like, you're that calm that they need at that very moment, and you validate that it's okay.
I've often said to families, I am positive that you did not think that your loved one was going to be laying in a hospital bed or an intensive care bed a week ago. That was not part of the family plan. And so there's tremendous disruption to a family to have a patient hospitalized. I've also said to nurses, how many of you have family members home right now who are saying like, gee, I hope by the end of the week I could be hospitalized. Nobody wants to be in our place.
Exactly.
Nobody is sitting home saying, please let me be in the hospital, or maybe my loved one could be hospitalized. But we have to be there when something that they don't want is happening. And I say for our system that every system should give good care, right? Everybody, there's wonderful healthcare systems all around us. But we can be the system that makes you feel the most cared about.
What's the best piece of advice that you've been given?
I think if I looked at it from a career perspective, it would be to take the chance. Don't get so comfortable that you're afraid to try something different. If I hadn't been willing to do that, I'd probably still be a surgical nurse at a place, which would be fine.
Yeah.
But I wouldn't have had a whole lot of other opportunities.
If you could do anything to improve the healthcare in America, what would you do?
Yeah, well, for me personally right now, it would be continuing this message about elder care, because I think this population is, which I will be a part of, this booming population, and what a difference we can make in the lives of people, so many millions of people, if we can ensure a healthier aging for them, and that we do ask what matters to them. And don't put them on medicines that they shouldn't be on. Don't put them on a bunch of Benadryl and stuff that we can make. And because when you improve the health and care of that older patient, you again are helping this entire family.
How are you keeping yourself physically and mentally fit during these very stressful and hard times at your hospital?
Zoom fatigue is real. And this inability to be able to move around the same way that we could is real. So we've done stuff, and I've done stuff, step challenges, just to force yourself to move, because it's easy to almost not move for an entire day. I do a lot for me personally. I work with a lot of chief nurses and nurse leaders around. For me to be able to talk to them about what are you doing with that? How are you helping your staff? I had 3 staff crying yesterday, and I don't know what else to support them, but be able to talk to other CNOs who are experiencing similar challenges and to get ideas from them, and again, some energy from them, helps me.
I want to ask you one thing. If you were able to jump into the future, what does healthcare look like to you? What do you perceive it to be and want it to be?
I think that healthcare in the future is going to be much more in control of the patient. The patient's going to have more control of their healthcare, that the demand and the right to have complete access to their health records, for them to be able to be much more commander of their healthcare. The traditional idea that we don't let them see their test results for 5 days and we don't do this. I think that's all very soon. It's already going away. The patient will be in command of their healthcare. They also will be able to get healthcare. They won't have to go locally for all their healthcare. So again, if you're not a health system or that allows that patient to feel well cared for, there's no reason for them to get a lot of their healthcare locally. I think it's going to be important for any health system to be able to let patients know we're going to let you easily get access to healthcare. We care about you. We're going to inform you, because the patient will continue to have a much stronger play in what they accept for their healthcare.
Barbara, it's just been such an absolute pleasure to speak with you. Do you have any final thoughts or advice for our care heroes?
My final advice would be just keep going. Just know that every healthcare worker has the opportunity to keep making a difference in patients' lives. And when you help the life of a patient, you're helping an entire dynamic around them. You're really changing the lives of a family. And don't let anybody forget how important it is that the people who are actually at the bedsides, who are touching people, if they can convey that I care about you as a person, what a difference you make in a patient's life.
You've just warmed my heart. Totally. You really have. You're just a wonderful person. Thank you so much.
That was such a great episode, Gerard. Barbara has such a sharp wit, and it's clear she knows her stuff.
That's right, and such a great example of how her education put her in a position to advance in her career, even at the start of it.
Absolutely. Now, it's time for the handover.
Okay, Care Heroes, here are our top takeaways from this episode. Listen to your heart and find your purpose. Follow the path that feels right for you and satisfies your soul. Be brave and step outside of your comfort zone. Opportunities come along, but nothing will happen if you aren't willing to make something of it. Communication is key. Always make sure that you communicate well with your team so that you all function as efficiently as possible. Don't stop educating yourself. You can always learn and become better than you were yesterday. Lastly, always remember, when you help one person, it can affect the lives of everyone around them. Every heart that you touch can result in a ripple effect.
Awesome handover, Gerard. We also want to thank our Care Heroes for listening, and don't forget to rate our podcast on your favorite podcast app. If you want a shout out on a future episode, just visit careheropodcast.com. Go to the Contact Us page and submit your name, role, and location for a shout out on a future episode.
Yep, that's right. Now it's time for some shout outs. We want to give a shout out to Clara, registered nurse from Huntington, Massachusetts. Anthony, licensed vocational nurse from St. Paul, Minnesota. And Mark, vice president from Palos Verdes, California.
All right, Care Heroes, thank you for joining us on the show. We'll catch you on the next one. Same Care Hero time, same Care Hero channel.
Thanks for listening to Care Hero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a Care Hero to be interviewed on a future episode.